let's take a moment to get honest, genuinely honest about your health, your confidence, and your future as a man. If you care about your personal vitality and well being, this is a conversation you cannot afford to ignore. You see, there are a number of habits, some of them incredibly common and even innocently done on a daily basis, that can quietly but steadily erode your erectile function, decrease penile sensitivity, and ultimately damage your long term sexual health. Now, I'm not here to alarm you or provoke fear. My purpose is to inform and empower you because when you understand the forces that work against your performance, you gain the insight and the power to protect it. And that's not just about one moment of intimacy. It's about confidence, self-esteem, and a quality of life every man deserves. Before we go further, take a second to subscribe if you haven't already, and drop a comment below to let us know where you're tuning in from. It's truly inspiring to see men from around the world stepping up and taking control of their health in such a powerful way. Now, here's a physiological truth that far too many men overlook. Your penis is an early warning system. Think of it as the check engine light on the dashboard of your body. When circulation, hormones, or heart health begin to suffer, your erectile quality is often the very first indicator. Why? Because the penile arteries are among the smallest in the body. They show signs of vascular compromise years before more serious events like heart attacks or strokes occur. So, if you've noticed a weaker, less reliable erection, it's not just old age. It's your body signaling that something deeper may be happening. And if you ignore those signs, you may miss a critical opportunity not just to preserve your sexual health, but to prevent a life-altering cardiovascular event. For those of you who are new, I'm Dr. Elena, board-certified urologist, with over a decade of experience in men's health and sexual medicine. I've had the privilege of treating thousands of men struggling with erectile dysfunction, hormonal imbalance, and prostate issues. And I'm here to tell you, small, intelligent changes can create extraordinary results. Today, we're going to walk through 10 things you should never do to your penis, habits that silently damage one of the most important parts of your body. And more importantly, I'll explain what to do instead so you can stay strong, functional, and confident for decades to come. And yes, stick around until the very end. I'll also share a researched, natural way to support healthy erections and blood flow, with or without medications. Let's begin. First, never ignore changes in your erection quality. Reduced firmness or changing response patterns are not random. They often point to endothelial dysfunction. When your blood vessels stop working efficiently, the penile arteries are only about 1 to 2 millimeters wide compared to your coronary arteries, which are larger. That's why erectile dysfunction can appear years before a heart attack. According to a 2018 meta-analysis in Circulation, men with erectile dysfunction are up to 50% more likely to experience cardiovascular events within 5 to 7 years. If your body is speaking, listen. Early diagnosis can lead to early intervention and possibly even life-saving treatment. Second, avoid risky and unproven home remedies. This is critical. I've treated men who ended up in emergency care after using bottle caps, constriction bands, or dangerous ring devices made from household items. Some of these cases required surgical intervention to prevent permanent damage. Things like applying vinegar, excessive stretching, or vacuum pumps without medical guidance can cause micro tears, nerve injury, and fibrosis, leading to long-term erectile dysfunction or even loss of sensation. Medical-grade devices exist. Use only what's clinically tested and FDA approved, and never apply anything that can't be safely and immediately removed. Third, do not neglect hygiene. It might seem basic, but it's astonishing how common infections and inflammation occur due to poor hygiene, especially in uncircumcised men. The accumulation of smegma, dead skin cells, oils, and moisture can create a breeding ground for bacteria and even increase the risk of penile cancer over time. However, don't overcorrect with harsh soaps or aggressive scrubbing. These strip away your body's protective microbes and oils, leaving the skin irritated or raw. The goal is consistent, gentle hygiene using pH-balanced cleansers, warm water, and a soft cloth. Rinse thoroughly and pat dry. Never rub harshly. Fourth, never ignore pain. lumps, or bleeding. Any unusual sensation, pain during intercourse, blood in urine, ulcers, or noticeable lumps should never be ignored. These symptoms could reflect infections, kidney stones, Peyronie's disease, or even malignancies such as pineal, bladder, or prostate cancer. Delaying care doesn't make the issue go away, it escalates it, often turning treatable conditions into more serious problems. Feeling judged or dismissed by your physician? Find one who listens. You deserve care that's respectful, discreet, and skilled. Fifth, don't take unnecessary physical risks during sex. As odd as it may sound, penile fractures are real. When an erect penis is forced or bent sharply, especially during intense or misaligned penetration, it can tear the tunica albuginea, the fibrous outer tissue. The rupture is often audible, described as a pop, followed by rapid swelling, discoloration, and intense pain. This is a urological emergency. If it occurs, go to the ER immediately. Delaying treatment can mean permanent curvature or erectile dysfunction. And remember, good lubrication is not optional. It reduces friction, enhances pleasure, and protects your tissue from trauma. If your partner is experiencing dryness, it doesn't indicate lack of desire. It might be hormonal, stress-induced, or medication-related. Use lube. Your future self will thank you. Sixth, avoid prolonged heat exposure to the testicles. Nature placed your testicles outside your body for one reason. Sperm production and testosterone synthesis require a temperature about 2 to 3 degrees Celsius cooler than your core body temperature. Long periods in hot tubs, placing laptops on your groin, or storing phones in your front pocket can impair fertility and hormones. Scientific studies, including those by the American Society for Reproductive Medicine, confirm that scrotal temperature elevation correlates with lower sperm count and a reduced Leydig cell function, the very cells responsible for testosterone production. Seventh, don't use excessive pressure during masturbation. A condition informally known as death grip syndrome is increasingly common. Using too much force or relying solely on aggressive, repetitive stimulation can desensitize the penile nerves over time. This can make partner-based intimacy feel underwhelming, causing mental and emotional frustration. Ease up, use lubrication, recondition your body to respond to more natural, moderate sensations. With time, nerve sensitivity can bounce back, as long as you break the pattern early. Eighth, never underestimate the damage caused by smoking. If there's one habit that utterly dismantles erectile health, it's smoking. Nicotine shrinks blood vessels, depletes nitric oxide, which is essential for erections, and accelerates atherosclerosis. It also raises the risk for aggressive cancers, especially bladder and penile cancer. Your genitals are vascular organs, and when your circulation suffers, so does your performance, sensation, and satisfaction. Quitting smoking improves endothelial function within just a few weeks and can significantly restore sexual capacity over time. Ninth, don't let shame or self-blame undermine you. Let me be clear, one off night doesn't define your masculinity, but internalizing failure can create a shame spiral where anxiety triggers the sympathetic nervous system, the fight or flight mode, which literally shuts down the erectile process. Stress hormones like cortisol constrict blood vessels and lower testosterone, creating the exact storm you're trying to avoid. The solution? Speak openly with your partner and your provider. Your worth is not tethered to performance. Connection, vulnerability, and honesty are part of true masculine strength. 10th, don't stop engaging sexually, solo or partnered. Use it or lose it isn't just a saying. It's grounded in medical science. Regular erections deliver oxygen-rich blood to penile tissue, preserving elasticity and sensitivity. Without that stimulation, fibrosis can develop, leading to reduced size, curvature, or sensation over time. Even nocturnal erections, common during REM sleep, are the body's natural maintenance loop for penile health. If those stop entirely, it may indicate a serious hormonal or vascular issue requiring further evaluation. Bottom line, consistent, healthy stimulation through intimacy or solo care keeps your sexual system responsive, nourished, and biologically active. So, what can you do starting today? Protect your entire circulatory system by exercising regularly and eating nutrient-dense, anti-inflammatory foods. Manage stress because cortisol literally counteracts testosterone. Maintain hormone balance through adequate sleep, resistance training, and medical evaluation when necessary. Practice smart hygiene. Avoid trauma. Respect your body. Recognize changes as clues, not curses. And if you're seeking natural, research-supported enhancement of erectile quality, consider L-citrulline, a compound found in watermelon extract. It boosts nitric oxide production, which widens and relaxes blood vessels in penile tissue, improving blood flow naturally and safely. I'll link a trusted source for this in the description. Erectile issues are not a sign of weakness. They're not the end of your manhood. They are signals, biological messengers asking you to tune in, take action, and care for yourself differently. I've seen men in their 50s, 60s, and even 70s not just restore their sexual function, but reignite their confidence, rebuild intimate connection, and reclaim control of their lives. A healthier, more vibrant version of you is possible, and it starts with awareness. So commit. Respect your body. Respect your future. Stop making these 10 silent mistakes. You're not just protecting your erections, you're protecting your heart, your health, your dignity as a man. If this was valuable to you, share it with someone you care about. Like the video, subscribe for more expert content, and tell us in the comments, what one change are you starting with today? And my mission is simple: to help men reclaim their vitality, their confidence, and their options. Remember, aging is inevitable, but decline is optional. With the right knowledge and consistent care, you can experience deep connection, lasting intimacy, and peak performance for life. Take care of yourself because you are worth it.